Hi friends, welcome to classes by Lab Doctor. In today's class, let us see what is the normal range of ESR and what are the causes for high ESR. Because many a times patients come with their reports, my ESR is 40, my ESR is 60, my ESR is 16. Do I need to worry? These are the common questions which we get. So, ESR in men we expect it to be 0 to 15 mm at the end of 1 hour, and in women 0 to 20 mm at the end of 1 hour. And if the age is more than 50 years, there is slight increase which is normal. That is why after the age of 50 an ESR of up to 20 in men and up to 30 in females is taken as normal. Okay. So there are many factors which can increase or decrease the ESR. This is important because to know what are the causes of increased ESR, these are the factors which play a role. So like I've told you, in old age, when the person becomes more than 50, there is a natural increase in ESR. In pregnancy, because of the hormone, because of the changed hemodynamics, the ESR tends to be high. That is normal. In anemia, ESR is more. In RBC abnormalities, ESR can be high. Macrocytosis, ESR can be high because of certain technical factors, or there is an increased temperature of the specimen. If the ESR tube is not kept properly, it was tilted. There is increased fibrinogen levels, infection, inflammation, injury, accident, malignancies. All this can increase your ESR. Similarly, if there is polycythemia, if there is spherocytosis, microcytosis, acanthocytes, if there are, certain technical issues, dilutional factors, you have not mixed the sample properly, there is already a clotted sample, that can reduce the ESR. Okay, if the patient has inborn errors wherein the protein levels itself are less, hypofibrinogenemia, dysproteinemia, hypogammaglobulinemia, these can also reduce the ESR. Now, what are the causes for increased ESR? In which clinical conditions we suspect increased ESR? I've told you ESR is a non-specific marker of an inflammation. So any tissue breakdown anywhere, it can be in your bones, in your joints, in your skin, in your lungs, in your heart, in your blood vessels, anywhere, any kind of an inflammatory process, any kind of a tissue breakdown can increase your ESR. The most common conditions where we see is your, inflammatory conditions. It could be a lung infection, pneumonia, a bacterial infection, a viral infection, a fungal infection, anywhere in the body, osteomyelitis, your ESR will be high. Okay, so any inflammation anywhere, bacterial, viral, fungal infection, your ESR is bound to go up. If the patient has an autoimmune disease, body is fighting against its own cells, but there is inflammation. Autoimmune disease are your rheumatoid arthritis, systemic lupus erythematosus, inflammatory bowel disease. The gut cells fight against their own cells. Your ESR is bound to go high. Ulcerative colitis. Patient comes with loose motions, constipation, blood in the stools. We do the blood checkup. ESR is high. Yes, some kind of an inflammation is going on, and he has this gut-related issues. So could be an inflammation in the gut. So we think of an inflammatory bowel disease. Chronic inflammation like giant cell arthritis, polymyalgia rheumatica, tuberculosis, your ESR is bound to go up. So inflammation anywhere in the joints, muscles, skin, RBCs, your blood cells, your blood vessels, your nerves, your blood vessels, your gut, anywhere inflammation, your ESR is going to be high. This is in case of an SLE, autoimmune disorder, butterfly rashes. This is a case of giant cell arthritis. You can see how prominent the vessels are. Okay. certain cancers, you have lymphoma, multiple myeloma, there is abnormal immunoglobulins, uncontrolled production of these immunoglobulins, and these are going to increase your ESR. You know, multiple myeloma is a case wherein there is uncontrolled production of this immunoglobulin. Patient comes with to do a normal blood test, we will see that his ESR is, very high. Doctor thinks whether this could be something related to multiple myeloma. They order the immunoglobulins, order your electrophoresis, the blood picture, bone marrow, and we diagnose multiple myelomas. So these cancers, multiple myeloma, they are another categories of diseases which can increase your ESR. Any kind of a tissue injury or ischemia, there is an accident, there is an acute inflammation, there is an acute trauma, ESR is going to go up. Okay, so diabetes, even patients with diabetes, the ESR is high. It is not that specific for diabetes, but because there is always a low grade of inflammation which is associated with this diabetes, patients who are diabetic, their ESR might be slightly high, and usually these patients, when their sugar is not controlled properly, they have diabetic complication, diabetic nephropathy, ulcer, foot, all this, diabetic foot, etc. So that time also their inflammation will be high and ESR also will be high. In heart disease, okay, in a patient who is having heart problem, an increased ESR can be associated with this heart disease. It's a non-specific marker again. There are again specific marker, especially your HSCRP, etc. But yes, because of the inflammation, low grade inflammation which is happening in the heart muscles, in the blood vessels of the heart, your ESR can be high. That is why, in high blood pressure, in atherosclerosis, what are these? This is nothing but an inflammation in the blood vessels. The ESR can be high. Patient who is having BP, the ESR can be slightly high because there is inflammation in the blood vessels. Okay, so in kidney disease, your chronic kidney disease, your end stage kidney disease, there also your ESR can be high. Obesity is a low grade inflammation. That is why the body is always under stress when the person is obese. So your ESR can be high in obese people. Your thyroid disease, especially your subacute thyroiditis, that time your ESR can be high because there is inflammation. Itis suggests inflammation. Your ESR can be high. Okay, so these were all the causes of increased ESR. It could be a bacterial, a viral, a fungal infection. It could be pneumonia. It could be osteomyelitis. It could be something chronic disease like tuberculosis. It could be an autoimmune disease like rheumatoid arthritis, SLE, a gut-related inflammatory disease like inflammatory bowel disease, certain types of cancers, leukemias, myelomas, lymphomas, wherein there are abnormal immunoglobulins being produced, diabetes, mainly because of low-grade inflammation or diabetic complications, heart disease, whenever there is atherosclerosis, there is BP, there is inflammatory process in the vessels, kidney disease, end stage kidney disease, chronic kidney disease, obesity, again a state of low grade inflammation, thyroid disease, especially your subacute thyroiditis, rheumatic fever, all these can increase your ESR levels. So patients have no specific symptoms for ESR. They have the symptoms of the disease. Patient might be having headache, patient might be feeling very weak, tired, he might have gut related issues, or he might have joint pain, joint stiffness in your rheumatoid arthritis, inflammatory arthritis, he might have neck pain, shoulder pain, there might be anemia, there might be loss of appetite, there might be unexplained weight loss, unexplained fever. So any symptoms can come because there is no specific specific symptom for ESR or high ESR. So whenever doctor sees that, you know, patient is telling of these symptoms, doctor orders this test as a routine test, and when he finds that, you know, the ESR is also high, he will try to narrow down that this non-specific inflammatory marker which is raised could be pointing towards which organ. Accordingly, more tests are ordered and the doctor pinpoints the diagnosis. So first, when we do ESR, it is just gives us a clue that alerts us, yes, that yes, there is something which is happening in the body. There is tissue breakdown which is happening, and we need to find out where exactly is it happening by doing specific tests. Okay, so that is how ESR guides us to go towards that direction. Sometimes you get low ESR also. I have told you, like in polycythemia vera, the RBCs are so packed that they cannot move, they cannot stack, they cannot form the rouleau formation. You might get low ESR. Sickle cell anemia, the cells are not in a position to form a rouleau. Okay, so if there are actual sickle cells, you may get a low ESR. In sickle cell crisis, when there is inflammation, then there is increased fibrinogen and then the ESR might go up. Sickle cell trait, when there are no actual sickle cells, ESR might be normal. So you should be very careful in interpreting it also. Okay, so these conditions like sickle cell anemia, the ESR might be less. In heart failure, the ESR might be less. I've told you that if there is excessive leukocytosis, the cells again won't be able to move, and you know, the ESR might appear low. Okay, so certain blood protein abnormalities. So patient is having hypofibrinogenemia, your ESR can go down. There are low plasma protein, you know, patient is having liver disease, kidney disease. The protein itself is less, so the binding factor only is not there. ESR will be less. Hyperviscosity syndromes, you know, all these can reduce your ESR. Certain long-term use of this anti-inflammatory drugs, steroids, they can also suppress your ESR levels. So these were few factors wherein your ESR could be increased or decreased. But what you have to remember is, many times patient ask, what I have to do to reduce my ESR? The answer is you have to treat the cause. किस वजह से आपका ESR ज्यादा है उसको ट्रीट करो. आपको लंग इन्फेक्शन है, हमने एंटीबायोटिक दिया, उसको ट्रीटमेंट किया, ESR अपने आप में कम होगा. ESR को कम करने के लिए कोई दवा नहीं है. ESR किस वजह से बढ़ा है उसको ट्रीट करने से आपका ESR कम हो जाएगा. पेशेंट को अगर ऑटो इम्यून डिसीज है तो हमको ऑटो इम्यून डिसीज को ट्रीट करना पड़ेगा. ESR को ट्रीट नहीं करेंगे हम. ऑटो इम्यून डिसीज को इम्यूनोसप्रेसेंट से हो, स्टेरॉइड से हो, पेन किलर से हो, इन्फ्लेमेशन को हम कम करेंगे उस मेडिसिन से, ऑटोमेटिकली ESR is going to come down. So when the patient asks how to reduce ESR, it is not the medicine which we give to reduce ESR. We give medicines to treat condition which has caused increased ESR. The patient is having chest congestion, chest infection, he is having pneumonia. We will have to treat his pneumonia. We will have to put him on antibiotics. Once the antibiotics will control his inflammation, ESR is automatically going to come down. Patients ask, what food I should eat to reduce my ESR? There is no food. There is no food which can reduce your ESR. It's all the process by which the ESR has increased. If you reduce that, ESR will fall down. So the treatment of high ESR is treating the cause. When you treat the cause, ESR is automatically going to come down. So these were few causes of increased and decreased ESR. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.